As coronavirus cases quickly skyrocket in states like Florida, Texas, and California, leaders there and around the country fear overwhelmed hospitals and more deaths from COVID-19.
Do we know if we're going to have enough hands to save everybody? I don't know. Are we going to have enough dialysis machines for everybody?
Arizona recording more than a quarter of its total cases since March, just in the last 10 days.
I'm frustrated because of what I see and what I hear from my constituents. That neighbors are going out, people having parties.
88% of ICU beds occupied in the state.
We are at capacity, and looking forward at the next few weeks, it's kind of scary and daunting.
Arizona's governor working to increase testing sites and pushing contact tracing to isolate people exposed to the virus.
Public health may be contacting you. It's important for you to answer the call.
In the Northeast, New York, New Jersey, and Connecticut will require a 2-week quarantine for anyone traveling from a state with an infection rate of 10 per 100,000. So far, that's 9 states.
If you are violating the quarantine, you can be subject to a judicial order and mandatory quarantine.
About half of U.S. states have cases on the upslope, many of them where restrictions have lifted. In Florida, Governor Ron DeSantis cracking down on businesses that don't comply with social distancing orders, dispatching his head of business regulation to clean up.
I guess he'll be kind of the grim reaper in terms of business licenses because there's not going to be any tolerance for it.
And as case counts mark record after record in California, Disneyland employees are petitioning to delay the park's reopening. But even where cases remain on the downslope, it's not all clear skies. Gyms in Michigan opened Thursday despite the governor's efforts to keep them closed. Now she's filing an appeal with a higher court. Just a slice of the nationwide struggle to balance economics with public health as case counts stack up. James Packard, Newsy, Chicago.